Second. Will the Senate please come to order?
I haven't read it either. Come to order.
So I believe we are on H-266, and the question is, shall the Senate concur? Senator from Chittenden.
Thank you, Mr. President. This morning, your Senate Health and Welfare took some time to review the proposal that came to us from the House Healthcare Committee. And I'd like to report a little bit of information about what they have sent back to us so that senators can make a decision about how to move forward with this proposal. Overall, the Senate Health and Welfare Committee supports the proposal as it came to us from the House Healthcare Committee. In order to understand this bill, I think we don't need to understand any more than we have in the past about the crisis that we're in on healthcare costs. We know that the trends for annual premiums for Blue Cross and Blue Shield have escalated radically since 2018. In fact, if we look at premium costs today in 2025 for a family of four, for our silver plan, our qualified health plan, folks are paying almost $50,000 a year. That's excessive. The maximum out-of-pocket expense for folks with silver plan in 2025 for a family of four approaches $20,000. So you combine that, that's a lot of money that people are paying. One of the things that determines those high costs for folks are prescription drugs. And so if we look at pricing for prescription drugs, one of the things that this proposal comes to us, the amendment that has come to us, is what's known as the average sales price for prescription drugs. And every year, or quarterly, Medicare, the CMS office at the federal level, publishes pricing files for prescription drugs. And then Vermont hospitals set their prices for drugs that they administer in medical settings on their charge master. So the hospitals set their own charge, could be based on the average sales price. And that's for both inpatient services and outpatient services. This bill deals with outpatient infusion, so drugs for people who have cancer, autoimmune diseases, and other critically ill folks who need infusion drugs in an outpatient or office setting. Well, just to give you an example of the prices that we're talking about, if we look at commercial payer drug pricing, and I'm picking one hospital in our state. It is the largest hospital in our state for current markup on the average sale price for drugs. The specialty drugs for infusion for an anti-inflammatory disease or autoimmune disease is 2,312% of average sales price. Cancer infusion drug, 943% of average sales price. A drug that reduces infection. When someone is ill, needs an infusion, the price increases 6,954% over average sales price. Another drug for cancer, 1,126% over average sales price. Blue Cross and Blue Shield charges 120% of average sales price on average for these medications. So that means someone is making a profit. It's the hospital making the profit off of the drugs that are infused in people who are critically ill. And then that profit goes to support other services in the hospital. Granted, that's what happens. That everyone acknowledges that. That's actually part of other sections of the bill. So, Mr. President, what is offered to us in the proposal as it has come from the House is to make a reduction on those increases to those infusion drugs for outpatient or in-office administration. So if you look at the proposal, essentially, I'll summarize it briefly because I know we can get into confusion if you start reading the word for word. But essentially what happens is in January of 26, there's a 120% cap placed on the average sales price that's published by the Center for Medicaid and Medicare Services. The cap is not a percentage of the Medicare reimbursement rates, but it is a cap. So it would be a cap for hospitals to pay 120% of their average sales price. There is also an effective date of January 26 that would put into place between July and January, there would be a slightly higher average sales price available percentage of 130%, and then it would be firm 120% going forward. Yes, what will happen is that hospitals will receive less money for those infusion drugs. There's no question about it. They will receive less money. The conditions of the bill indicate that they will not be able to balance bill. They won't be able to charge more somewhere else to make up for those infusion drugs that are given to people who are critically ill. We put a lot of cost on people who need the care the most. Other part of the bill includes the ability for the Green Mountain Care Board to adjust budgets. Budgets are being developed over the summer, so beginning in July, hospitals will have their budget process going forward. And as those budgets are developed, and as this new provision is in place in July, and the cap is placed of 120% average sales price on those infusion drugs, Green Mountain Care Board, when we took testimony, indicated that there's an opportunity for consideration of what is happening throughout the budget and how these provisions will affect the hospital budget. So there's an opportunity then for change. Going forward, considering this as a reference-based price for drugs, the Green Mountain Care Board will have an opportunity to make changes to this as well. Oh, this is not, so what will happen to us? What's the savings that we see here? For our school staff, we'll see a 3% decrease in premiums. Significant. It's like $12 million off the top. For our qualified health plans, we'll see a 4% decrease in premium costs. It's huge. So we'll see savings in the cost of health insurance with having this go into place, just for those drugs that are marked up so high in for outpatient and office infusion procedures for people who are critically ill. So, Mr. President, that really is what's here in this proposal. It is an opportunity to look at and to reduce prescription drug costs that have been a cause for increased premiums. And not only that, at the same time that those premiums are going up, Blue Cross and Blue Shield, our only domestic insurer, has seen a reduction in its risk, a reduction in its ability to compensate, losing money. We've talked about this before. Blue Cross and Blue Shield has been very close to going under, and this is one of the reasons. So this proposal, Mr. President, yes, will reduce hospital funds, revenue, however you want to look at it. But that revenue would be coming from people who are really sick, who can probably pay the least. It will help reduce premiums for our qualified health plans, for our schools, for our state employees and others, our small businesses. That's what we're looking for. This is that opportunity to make those reductions. As I said, your Senate Health and Welfare Committee did vote. We did a straw poll. This is how we do it, on a proposal from the House, an amendment, and we supported this. We support this. And one key point that's in the bill that I think that some of you should know is that our critical access hospitals, our smaller hospitals, are exempt from this. So they're not included in that. So they're some of the ones that, you know, are in trouble right now. Some of them are in red. But the Green Mountain Care Board is very much aware of their financial instability, just as they're very much aware of not wanting to destabilize our larger hospitals that we have in the state. We're trying to restructure the financial system, the healthcare system, so that we can reduce the cost to patients. So, Mr. President, that is the summary of what's here. And I do ask that the body support, the Senate support this proposal. Thank you, Mr. President.
Are you ready for the question? Senator from Essex.
Thank you, Mr. President. I'm at the expense of sounding like I'm going to ramble on for a little bit. I don't mean to do that, and I don't mean to take away any of the fine testimony given by the chair that we just heard. There's a lot of victims in the cost of health care. The Green Mountain Care Board hasn't always done the best job. In fact, some of the decisions they've made have been very suspect. The Oliver Wyman report being one, spending all kinds of money to cause angst amongst the communities. The insurance companies have been close to bankrupt more than once. It just happens to be this is the time they're going to do it again. I do know that we have to be very, very careful about who we're picking on as far as victims when you start talking about hospitals. I mean, that's where we go to get better and when we're sick and all. And I do know that we seem to be saying that for them to make any types of money, that it's a bad thing. Well, I'm in business, and if I didn't make money, I guess I probably wouldn't even be able to afford to be here, because this isn't a moneymaker, as we all know. So I'm very concerned about the path we're taking, because I know this. I know that when some of these larger hospitals make money, that they send providers or people into my communities that we can't afford to have a 5-day-a-week position. They might be there for 1 day a week, or they might be there for 2 days a week, or they might be there for 3 days a week. And they don't do that if they don't make money. They don't do that. They can't afford to send people into my impoverished community to provide better health care if they haven't made some money. And once we start to siphon them off, then that care stops, as we've seen. I wish that this bill was earlier in the season, and I wish it wasn't so late in the year, and I wish that we had more time to talk about it, and more time to think about it, and more times to go with it. And probably if I didn't have my 2 hospitals telling me that I had to vote no on this bill, or not had to vote no, asked that I would vote no on this bill, I would probably find a way to support it. I do appreciate the testimony that we had just heard, the floor report that we just heard. But being that my 2 hospitals, who I've got a lot of respect for and do a lot for my community, are asking me, even though they're not directly affected by this act, they certainly need these hospitals, bigger hospitals, to make money so that they don't have to try to hire somebody for 5 days a week when they can only use them for 2. But I have to be no on this bill, following to what my two local senators have asked me to do. Thank you, Mr. President.
Senator from Washington.
Thank you, Mr. President. I was the reporter when this bill came through here originally a couple weeks ago. It was the white bagging bill at that point, and we passed it out. I'm very cognizant that businesses need to make money. I was in the same business as the senator from Essex. But you heard the numbers, $50,000 a year with a $20,000 out-of-pocket expense. That is probably more than the average family in the senator's district makes. That's a lot of money. I've been told I believe it's the same plan, silver or bronze plan, costs twice as much as essentially the same plan in Maine, a family plan, similar demographics. We have reached the point where if we don't get the cost, everybody knows that hospitals need to make a profit. But a 6,000% markup, a 200, 300% markup. There's a graph, it goes like this across the country. Massachusetts and Rhode Island, similar New England states, are the bottom two in the cost of what these are their charge for these drugs. Vermont is by far number one, the highest. We are highest by an inch on that graph. I mean, we stand out. Our people can't afford this. When they can't afford health care, they don't get health care. They show up in our emergency rooms. We aren't the big city. All our hospitals are not for profits. So they have to take us. They can't ship you to the city hospital like you hear the stories in the big city. They have to take you. They have to provide you care. And then when you can't pay, the cost of that care gets shifted on to the rest of us that still can afford health insurance. And we start this nasty spiral where the costs just keep being driven up because of the high costs. No one else can afford health care. I think there's going to be an amendment coming that will alleviate some of this. I didn't hear any of the hospitals say absolutely no. There was an issue with the phase-in time. We were told that we didn't have time to get a change through. Now it looks like maybe we will. But this is just one of those areas where Vermont is across the board. We did the white bag bill in here, and that essentially did the same thing. It said they can get it cheaper, they can have it, the insurance companies, they can have it shipped to the hospital, and the hospital will use that drug at that reduced price. It's all in trying to. We have an infusion center that's what they do. You have medical people on premises that the price they charge is hundreds of % lower than the local hospital to do essentially the same thing. You need to have staff in case there's a problem. But basically, they hitch up to an IV and you sit there for an hour, 2 hours, however long it takes to have the drug put into your system. The numbers are just too extreme, and we are too far off the national norm to be able to continue.
Senator from Rutland.
Thank you, Mr. President. Would this be a good time for an amendment?
This would be a fine time for an amendment if you would like to propose one.
Thank you, Mr. President. So I propose an amendment with further proposal of an amendment from the House. It's basically first by striking out Section 5, outpatient prescription drugs, limitation on hospitals' charges for 2025 in its entirety and inserting in lieu thereof a new Section 5 as reads as follows. Basically moving Section 6, if you want to look on page 3165 in your calendar. Section 6, effective date by striking out subsection B in the entirety and renumbering it subsection C to be subsection B. Basically what this does, it's delaying the start date for the prescription drug cap to the 1st of January 2026. And that's a win-win because hospitals will have the time to prepare and insurers can still reduce their premiums by 4% because their health insurance plans are on a calendar year. So my critical care hospitals in my district and others are asking for 6 months, just 6 months to get their affairs in order and to work with the Green Mountain Care Board to make changes and adjustments that they need. Thank you, Mr. President.
Senator from Chittenden.
Thank you, Mr. President. So this is a proposal, a discussion that your Committee on Health and Welfare did have when we took testimony this morning, in particular from Northwest Hospital and UVM MC. Our concern is that we want this bill to get over the finish line. We want it to be whenever it passes out with whatever amendment or non-amendment, that it go to the other chamber and gets voted on effectively, and it doesn't get delayed or stopped dead in its tracks. So, as I said before, hospitals will be looking at budgets and would have an opportunity before the Green Mountain Care Board to adjust their budgets based on the 120% cap. As we look at this, if this is the amendment that gets the bill out of this chamber and over to the House and back again, our committee would not stand in the way of this amendment. It's not something we love. It's more of a procedural issue. So having said that, I see everyone saying, what is she saying? I would say that our committee in the cloakroom just said that we would support this proposal of amendment. Thank you, Mr. President.
Senator from Addison.
Thank you, Mr. President. So the number one thing that we have been talking about in this chamber that is the emergency that we are trying to address this year is healthcare costs. Healthcare costs are driving everything that we are doing. The entire massive education bill that we're doing largely is driven by healthcare costs, because that is one of the cost factors that is driving school budgets up, making our property taxes go up. Small businesses can't afford their health insurance. There was an article in the paper that I just read about a farm in the Northeast Kingdom who couldn't afford the new health insurance rates because they are so high, driven by high prescription drug costs. In talking to people in the building that I know very well who do healthcare policy, I have been told that this is the one thing that everybody is agreeing will actually reduce healthcare costs and will do it quickly. Everything else that we are doing in all of these lovely bills that have come out of your Health and Welfare Committee will take time. Reference-based pricing, which I 100% support, will take time. It won't be an immediate fix. All of the other things that were recommended in the Oliver Wyman report and every other report that we've done over the number of years will take time. We don't have time because Vermonters cannot afford healthcare right now. They cannot afford to pay their bills, to pay their health insurance, and to pay the payroll costs of their small businesses or their schools or the hospitals themselves, the healthcare providers themselves can't afford healthcare costs. Our FQHCs, our federally qualified health centers, are going out of business because they can't afford the health insurance for their employees. This is a provision that we can put into effect immediately, and it will have immediate impact on the cost of healthcare for some of the neediest Vermonters and all of us. As the senior senator from Washington explained, when one person can't afford their health care, it affects everybody's prices. So I really urge the body to vote down this amendment, to support this bill, to get it back over to the other body and move it forward so we can see some immediate effect on the cost of health care in Vermont. Thank you, Mr. President.
Senator from Rutland.
Thank you, Mr. President. I rise in support of the amendment. In my own district, Rutland Regional Medical Center has let it be known that, and with all due respect, again, I think the senior senator from Chittenden Southeast made a great point earlier. But again, in my situation, Rutland Regional is facing a $16 million loss in revenue. And I think, again, if you look at all the facets of what we're talking about, that means a loss of jobs in the Rutland region, a reduction in services that could be provided by that institution, and longer wait times. So if this amendment gives a longer runway and ultimately affects passage of this bill, I do support the amendment, and again, would at that point reluctantly vote yes on the bill. Thank you.
Senator from Windsor.
May I inquire the presenter of the amendment?
The presenter of the amendment is interrogated.
Thank you, Mr. President. So I'm trying to understand your amendment, or the amendment, and it says that you're striking out section 5 of H226, and I just want to make sure I'm looking at the correct section. So I believe I'm looking at page 3,165 in today's calendar, which is the start of section 5. Is that correct?
Correct.
So you are asking for in your amendment, if I can just read from the section of the bill, what I read is that a hospital shall not submit a claim to a health insurer for reimbursement of a prescription drug administered in an outpatient or office setting, July 1st, 2025 through December 31st, 2025, in an amount that exceeds 130% of the average sale price. So you're striking that in your amendment?
Correct.
Okay.
The senator is striking that.
In the amendment. Okay. So, and so is Rutland Regional, is your hospital a critical access hospital?
Senator, is the senator's hospital.
Okay.
We're
we
back
can-
to you,
okay.
York, please.
There's nothing in Mason rules that says you can't say you, but I will defer to that.
Yes, the questions are supposed to be directed at the president,
Can answer.
not the senator. So.
So you, Mr. President, in your amendment, can I ask a question of, is Rutland Hospital a critical access hospital?
No, it is not.
Okay. Is it an affiliated with another hospital? So, okay, that's helpful, thank you. Because my understanding is what this section does, it actually does exempt critical access hospitals, but you're telling me that your hospital in question is not a critical access hospital. Okay, that's helpful. So I'm not in favor of your amendment, but I do just want to understand, because the way you laid it out did not describe to me the deletion of this section 5. So I want to understand what actually would happen with deleting section 5.
My understanding is that we're just moving a date from 1 July 2025 to 1 January 2026, giving them 6 months.
So so perhaps I'm confused. So deleting section 5 in its entirety would not actually get rid of that section. It would just delay it 6 months out?
Correct. That's my understanding. Yes, sir, Mr. President.
And that's, okay, that's helpful. So with that being said, what would happen to someone who is unable to afford the 130% increase during that 6-month time?
I guess they're gonna have to pay it, Mr. President.
I appreciate the senator's remarks. Thank you. And I'm going to sit now. Thank you.
Thank you, Mr. President.
Senator from Wyndham.
Thank you. Mr. President, this seems like a really unpleasant game of whack-a-mole in which no person or entity really ends up with a positive outcome. I'm frankly unclear on this circular process here. May I interrogate the presenter of the amendment?
Presenter of the amendment is interrogated.
So I'm first understanding that the underlying bill would reduce healthcare costs for Vermonters, but this would lead to a reduction of revenue for hospitals. Is that sounding correct?
The question should be directed at the amendment only. That sounds like a question for the chair of the underlying bill.
So I'll rephrase, I can rephrase the question. Is the purpose of the amendment being done to reduce the, I'm sorry, let me rephrase this. I think that I'm trying to understand that the amendment will delay implementation of the bill. Is that correct?
Yes, Mr. President.
And that would allow hospitals more time to increase what they receive from health insurance companies in order to match the reduction in revenue?
Mr. President, it will give them time to prepare for this change and for the insurers to still reduce their premiums by 4%.
So the health insurance companies would end up reducing their premiums. So, okay, I thank the member from Rutland. My main concern is that a year from now, we end up back in square one where health insurance companies are raising their rates once again, even though the costs are being reduced for Vermonters, and then that's having an impact on the hospitals, and the hospitals are then trying to remedy their revenues and their costs, only to result in the health insurance companies having to raise their rates again. So perhaps I'm misunderstanding something, but it just seems like a constant cycle in which there really aren't any, in which no one is particularly benefiting. Thank you.
Are you ready for the question? Senator from Chittenden Central.
Thank you, Mr. President. I was someone on the committee who voted no on this amendment. As I said in my committee this morning, this crisis has been brewing now for 10 years, so this isn't a surprise to all of the parties involved. We hear about lowering hospital revenues. That's actually something we need to do. That's one of the ways that we will save the system, is by lowering revenue. I also wanted to just say that I believe, I wasn't here in the Senate at the time, but I think the Green Mountain Care Board is an invention of the legislature. And I think the Oliver Wyman was also something that was asked for by the legislature. These are things that we are doing to try to save our healthcare system. I'm confounded that we face these crises and then we're given a tool to actually fix the crisis, or crises in this case. We're given the opportunity to make reform and then we don't want to do it. And I find that extremely confusing. This is something we can do now. This is going to save people money now. My district is full of small businesses that are begging me to do this. We are working on education legislation and people are begging for their property taxes to be lowered. This will do that. I really hope folks understand the critical nature that we're in with our health insurance company, Blue Cross Blue Shield, here in Vermont. and I hope they understand the importance of taking bold action to save our one domestic insurer. Thank you, Mr. President.
Senator from Madison.
Thank you, Mr. President. I just wanted to point out something in the bill that might help ease the concern that the senator from Wyndham brought up about a hospital then raising its rates in order to offset the loss of revenue. In both sections of the bill that relate to the prohibition of charging more than 120% or 120%, there is and you can find it on page 3166, paragraph B1, if you're interested. The purpose of the section is to reduce healthcare costs. A hospital shall not charge or collect from the patient or health insurance any amount for a prescription drug administered in an outpatient or office setting that exceeds the amount set forth in this section, or increase the amounts the hospital charges for other prescription drugs, procedures, tests, imaging, or other healthcare costs or services in an effort to offset revenue reduced as a result of implementing this section. So this section is meant to prevent hospitals from, I can't remember the term, it will come to me as soon as I sit down, but essentially offsetting their loss in revenue in one way by increasing it in another way, Mr. President. So there is protections for this, and this is all sort of checked by the Green Mountain Care Board when they do the hospital budget review and the insurance company budget review. So that should hopefully help address the concerns brought up by the senator from Wyndham. Thank you, Mr. President.
Senator from Chittenden.
Thank you, Mr. President. And then to continue to help respond to concerns that this is a short-term event. Once this goes into place, including the balanced billing that the senator from Madison was talking about, once this goes into place, it's permanent. So the 120% of average sales price will stay in place. Hospitals will not be charging more than that unless and until the Green Mountain Care Board, as I indicated earlier, makes a decision about reference-based pricing for prescription drugs. So the board will now have that opportunity to look and see how this is working and to offer some relief to hospitals, should that be necessary, either through the budget process or through the looking at the cost of drugs overall and changing that 120%. So there is that provision as well. So it's not a temporary thing. Once it starts, it goes ahead. I think if you recall last year, we put in place a prescription drug advisory group with the Green Mountain Care Board. I'm thinking that this is the place where that board will begin to do more work in this area, because the cost of drugs really do significantly increase costs in our state. And we are the highest state for private health plans in the country. So we need to do this. The question before you now is does it begin in July, or does it begin in January? And budget process is going on through the summer and fall, and then rate setting continues after that with respect to insurers and hospitals. Thank you, Mr. President.
Are you ready for the question? Senator from Madison.
Thank you, Mr. President. I'll be voting yes on this amendment. And the reason is that we are giving these large hospitals, multi-million-dollar budgeted hospitals, 1 month to get this implemented. We've stood here before and listened to how people don't have time enough to do stuff, and how we've extended for our legislative council or our other bodies of the government, that we need to give them more than just a month to get their business in order to implement any new law that we pass. So I'm asking the body the same. Don't give them just a month to get this implemented. Give them another till January 1st. Thank you.
Are you ready for the question? The question is, shall the Senate concur in the House proposal of amendment with further proposal of amendment? Are you ready for the question? Senator from Windsor.
So I'm sorry, my head's been in a very different place most of the day, and healthcare is not my forte, but I do understand markup when I see markup. And so am I simply to understand that we're going to, if we vote yes on this amendment, we're going to allow a hospital or hospitals to continue to mark up in these really egregious fashion? In a healthcare crisis, we're going to allow hospitals to continue to mark up these life-saving drugs for another 4 months when we could act immediately now in July versus January. Is that what I understand is happening here?
Who are you questioning, Senator?
That's a good question. I guess I'm asking
Is it a
actually,
rhetorical
I think I would
question?
like to interrogate the chair of Health and Welfare.
The senator
reporter
from,
bill.
the senator from Chittenden is interrogated.
Madam Chair, do I understand correctly that by voting yes on this amendment, we would be allowing this really egregious markup of incredibly important life-saving drugs to continue for another 4 months?
Mr. President, I can't actually answer that question because I don't know what the hospitals will do in response to the bill as it goes forward, with or without this proposal of amendment. I think the hospitals are exceedingly concerned, and we may see a response.
Well, there we have it. Thank you. It's clear as mud.
Senator from Rutland.
Thank you, Mr. President. Just seeking clarity, if I could quickly interrogate the Chair of Health and Welfare, please.
The chair is interrogated.
I believe the senator said earlier that when the amendment was presented in the cloakroom, that the official position of the committee was in favor, perhaps reluctantly, but in favor of the amendment. Is that true, Mr. President?
It was a straw poll, and you are accurate.
Thank you.
Are you ready for the question? Senator from Orleans.
Point of information, Mr. President. This vote that we are about to take is on the amendment and the entire bill, so
Yes.
is that true?
Yes.
So this will be my last opportunity to speak on the bill as a whole,
Yes.
including the amendment.
If it passes, it would be.
It would be. Okay, then I will stand up again.
Go ahead.
Mr. President, I just want to say one thing. I really thank the House for putting in the protection for critical access hospitals. I've spent this entire session in health and welfare protecting critical access as much as I can because those are my hospitals. And sometimes, I would say off to the chagrin of the chair of health and welfare, I have been rather annoying on that issue. And I appreciate the chair's willingness to indulge me from time to time on this. But I really do thank the House for including this because where I may not have always been successful, they were successful in putting this language in. And I appreciate the Green Mountain Care Board's willingness to include this language to protect critical access hospitals. Not talking about the amendment, the bill as a whole, or sorry, the House proposal amendment as a whole, I appreciate them putting the protection for critical access hospitals. Thank you, Mr. President.
Senator from Addison, are you requesting to speak a third
I
time?
have a point of information.
What
and
is your
it's
point of information?
Similar, because I didn't quite understand your answer to the senator from Orleans.
I will restate the question, and the question is, shall the Senate concur in the House proposal of amendment with further proposal of amendment? So if you vote in the affirmative, or if the majority votes in the affirmative, this bill will be amended and we will have concurred. So this will be the last vote if it is in the affirmative.
If we vote if the Senate votes in the negative, what happens then?
Then we go back to the original proposal without the amendment.
Okay, so this is not necessarily the final vote, depending on.
You're
how this
correct.
goes.
If the Senate votes no, the question will then be, shall the Senate concur with the House?
Got it. Thank you, Mr. President.
Are you ready for the question? Senator from Chittenden North.
Thank you, Mr. President. May I inquire the presenter of the bill?
The chair of the committee is interrogated.
I was just thinking while I was trying to wrap my head around dates and things like that, and hearing saving on healthcare costs right now. If this bill were to go into effect as originally stated, July 1, 2025, would you actually see would the senator know if you would see a reduction in your healthcare premium or a copay or anything that has been negotiated already that's in effect for this year?
Well, you would see a reduction in the charge or the cost of those infusion drugs. So in that sense, you'd see savings for the insurance company and for the patient as a whole, certainly if there's out-of-pocket costs. So, and then as the budget is put together over the summer and fall, you would see perhaps a reduction in the budget, and then you would see a reduction in rates going forward during the rate setting process later on in fall and winter.
Would would the senator be able to tell me if the hospital had a patient that had met their out-of-pocket max and they then have a copay for going into the hospital receiving these expensive drugs, would they see any reduction in any costs based on the July 1 timeframe?
I don't think I can answer that question. It depends on what their insurance premium looks like, what they're covered for, so.
But would their premium change mid-year?
Their premium will change when the coverage changes. It's not automatic.
Now can the senator tell me if that coverage would be effective January 1, 2026?
I cannot tell you that. I don't know when their premium changes. I don't know who they work for, what their qualified health plan looks like, and so on. All I can tell you is that we will see a reduction. And for example, as school boards negotiate healthcare premiums and costs, we will see a reduction of 3 to 4%. As folks go in during the later fall and winter, should we begin in July, we will probably see a reduction in those costs as well, to the tune of about 4%.
Okay. No further questions. I was just trying to get clarity on when the premiums take effect, when the costs would be hitting the consumer's pocket. So I thank the senator for the clarification on that.
Are you ready for the question? The question is, shall the Senate concur in the House proposal of amendment with further proposal of amendment? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay.
Nay.
The ayes appear to have it. The ayes do have it. Division? The division has been requested. All in favor, please stand. You may be seated. All opposed, please stand. You may be seated. The ayes voting 20, the nays voting 10, and the proposal with further proposal of amendment passes. Senator from Chittenden.
Thank you, Mr. President. At this time, I would move that the Senate suspend its rules in order to move immediately to S45, taking it up off the notice.
The senator from Chittenden has moved that the Senate suspend its rules to take up S45 for immediate action. Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. The ayes have it. and we will take up S45 for immediate action. S45 was passed by the House with proposal of amendment. The question is, shall the Senate concur in the House proposal of amendment? Senator from Wyndham.
Mr. President, I would ask for a conference committee to be formed.
The senator from Wyndham has asked that we appoint a conference committee. Okay. And the motion is, shall the Senate not concur and appoint a committee of conference? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. The ayes have it. We will.
If I could ask, Mr. President, for a 1-minute recess.
We'll take a 1-minute recess. Will Senate please come to order? Senator from Chittenden.
Thank you, Mr. President. At this time, I would move that the Senate suspend its rules in order to message actions taken on 2 of the bills we did today. S45, an act relating to protection from nuisance suits for agriculture activities, and H266, an act relating to the 340B prescription drug pricing program, and that we would message those to the House forthwith.
The senator from Got it. Senator, I have been informed that before we do that, we should announce the committee of conference. The committee of conference on S45, Senator Norris, Senator Plunkett, Senator Ingalls.
With that, Mr. President, I would redo my motion and ask that the Senate suspend its rules in order to message the actions just taken on S45, an act relating to protection from nuisance suits, and H266, an act relating to the 340B prescription drug pricing program, to the House forthwith.
Senator from Chittenden has moved that the Senate suspend its rules in order to message our actions on S45 and H266 to the House forthwith. Are you ready for the question? If so, all in favor say aye.
Aye.
All opposed, nay. Ayes have it, the motion carries. Senator from Chittenden.
Thank you, Mr. President, and I thank the body. If you look at your calendar and you subtract what we did today, you will see we are rapidly heading toward adjournment. It is my hope that we will tomorrow see all of our conference committees come back. It may be that not all of them come back and we have to contemplate a slightly longer session. We will work like dogs to try to make tomorrow the last day, but in other words, until it happens, it hasn't happened. So with that said, Mr. President, pending further announcements, I would move that the Senate stand in adjournment until 10 a.m. Friday, May 30th.
The chair has a couple of committee announcements. The Nuclear Decommissioning Advisory Panel, Senator Watson. The Joint Public Pension Oversight Committee, Senator Perchlik, Senator Collimore, Senator Vyhovsky. VSAC Board, Senator Cummings, and the prestigious Vermont Milk Commission, Senator Major. Are there any further announcements? Senator from Rutland.
Thank you, Mr. President. Senate Government Operations will meet at 9:30 tomorrow to seek concurrence on some changes to the OPR bill.
Are there any? Senator from Washington.
Thank you, Mr. President. Senate Natural Resources and Energy is going to meet tomorrow at 8:45 to hear about the changes to S-124. Thank you.
Senator from Essex.
Thank you, Mr. President. Senate Agriculture is going to meet with our new favorite committee at 8:45 at the same time. Thank you, Mr. President.
Senator from Chittenden.
Thank you, Mr. President. Senate Health and Welfare will meet at 9:30 tomorrow morning to look at a resolution that has come to us on Alzheimer's disease. Thank you.
Are there any further announcements? Senator from Lamoille.
Senate Transportation will meet at 8:45 tomorrow morning.
Senator from Franklin.
Senate Economic Development, Housing, and General Affairs will meet at 9 a.m. tomorrow to take additional testimony on cannabis.
Are there any further announcements? Seeing none, the senator from Chittenden has moved that the Senate stand in adjournment until 10 a.m. Friday, May 30th, 2025. Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. The ayes have it, and we'll stand in adjournment until 10 a.m. Friday, May 30th, 2025.